you are a direct contact and are not showing symptoms of COVID-19. I want to be very clear that the changes we are announcing this evening will increase the risk of transmission, and we may see some additional hospitalisation. But we're confident that such an increase will be small and manageable. We know that vaccination significantly decreases the risk of serious illness, and given the strong position we are in with our vaccine rollout, public health officers and the Deputy Medical Officer of Health, Dr. Ivan Muscat, do agree that what we are doing today is a proportionate step. These changes do not alter the rules for people who test positive. If you test positive for COVID-19, you must isolate, and if possible, you should reduce the risk of further transmission by isolating away from the other members of your household. Islanders can also do their part to keep the risk of transmission as low as possible. Maintaining our enhanced hygiene practices should now be second nature to us, and it's important that we don't become complacent about those. Physical distancing remains vitally important to keep the risk of transmission low, as does vaccination. 4 out of 5 islanders aged over 30 have now received the first dose of the vaccine, and everyone who is 18 and over is now able to get their jab. So if you haven't done so yet, please fill out that simple form on the gov.je website. It's quick and it's free, and it's the most important thing you and anyone can do to keep yourself and those around you safe. Every one of us has a responsibility to our friends, our family, our colleagues, and our community to do our part to minimize the risk of spread. So thank you, and I will now hand back to the Chief Minister.
Thank you, Richard. I hope the changes we have announced this evening will be welcomed by islanders. These changes will come with increased risk of transmission, as we said, but public health officials are confident that the actual number of severe cases will remain manageable and the risks to public health are low and proportionate. It has been 15 months and 3 weeks, I'm told, since the first case of COVID-19 was confirmed in Jersey. In that time, our community, our economy, and our daily lives have been transformed as we have risen to meet this threat to our public health. And islanders should be especially proud of the way in which they have responded to the pandemic. We have been successful only because of the cooperation of islanders, and together we've kept schools safely open, we have mobilised the largest financial support package in Jersey's history, and we've undertaken a vaccine rollout which ranks amongst the fastest in the world, and which has significantly reduced the chance of serious illness. These latest changes reflect the next step in our pandemic response as we begin to learn to live with COVID-19. And we can expect to see cases rise in the days and weeks to come, but the severity of this increase, the risk of hospitalisation and of serious illness will be kept low and will be proportionately managed. Please keep doing your part to protect our public health and stay safe. And we're now going to take questions from the media. So, nice to see everybody on a sunny Sunday, but I believe, hopefully, if I go through the names, we have Mike from the JP online, we have Fiona from Bailiwick online, we have Freddie in the room, we have Gary in the room, and we have Harry in the room from 103. So we'll go, I think, Freddie first, and then we'll alternate between in the studio, in the room, and online. Freddie.
Good evening, Chief Minister. Thank you very much, and Ministers and Dr. Ivan Muscat as well. Just after you've been speaking, I've just been contacted in the past few minutes by people confused and a little bit unsure about this announcement, I suppose. One in particular who's contacted me saying just this morning they've been told that they're a direct contact of somebody who's tested positive today. They have therefore been told tomorrow morning to go for their day zero test, them and their two very young children. Of course, this announcement now means they don't need to isolate and supposedly can send the children to school or to nursery. Is that the right thing for them to be doing? Is that a sensible thing? And what would you say to islanders who are in that situation and feel very unsure about what you've just announced?
So what we're trying to say, and I'll hand over to Ivan and to Richard in a sec to give more background. What we're saying is that given the difficulties that have arisen over the last few days, and in conjunction with where we are in the vaccination process and the fact that actually each day, each week and each day, more and more people have either been getting their first jab or actually completing that fully vaccinated status. And therefore, the balance that we've always followed, which is about balance of overall harms, is essentially tipping to a more open position. And that more open position is therefore allowing, given the balance of harms that are coming through, because it's actually more children and younger people who are getting that direct contact, that actually we can move to the position where we are stating. I think, Ivan, do you want to make an observation overall?
I completely agree with what the Chief Minister's said. Our strategy has always been, from the very outset, that we need to minimize harm by balancing the harms caused by the COVID virus and infection thereof, and the restrictions that we apply to counter the harms caused by the virus. Directly as a result of the successful vaccination program, which is still ongoing and coming towards near 100% coverage of the eligible population, the significance of COVID infection has changed hugely. As you know, COVID causes much less severe disease in young people and people without underlying conditions. The vaccination program rightly started in those most at risk and the elderly and rolled itself through the age cohorts towards the younger age groups, which is where we are now. As a result, the significance of COVID infection is completely different. The burden of disease caused by COVID infection has reduced significantly. Therefore, we need to adjust the restrictions we apply to managing COVID accordingly. And this is one further step in that direction. It is a dynamic process. It is therefore easy for people to not keep up immediately with each change, because we are trying to be as balanced as possible on a day-by-day basis, but it is the right thing to do. Bearing in mind that for each positive individual that we find, there are something like 10 direct contacts. So if the damage caused by infection is reduced significantly, then the damage of keeping 10 direct contacts in isolation for 10 days or thereabouts is disproportionate, and we are trying to redress that.
Okay, thank you. So yeah, to summarise, I suppose, in that situation, do send the kids to school tomorrow is the summary.
Isolation, but they do need to be tested if.
Sure. Okay, thank you. And just for my second one, if I may, some numbers. I remember at the end of last year, I think it was late November, early December, you took on more staff for the contact tracing and helpline teams. I think we got up to 90, more or less, at that time. And my understanding is since then, a number of staff were told that their contracts weren't going to be renewed. And as a consequence, I presume that the team shrunk. How many staff members have we had in recent months, and is that why we've now been in the situation over the past few weeks?
The present numbers are there are 74 in the team, and a further 30 are being brought back online during the course of this week, some of whom will be starting tomorrow. So the core of the team has been reasonably substantial, and we have taken action, which was in the pipeline anyway. So we think that with the increase in people coming in, plus the measures we put in place, that will then bring everything down to a manageable level.
So you're saying from tomorrow we'll have 104?
Yep.
Okay. And is that some kind of acceptance then that maybe letting those staff go previously was a mistake in any way, because that's perhaps led to the situation we've seen?
Well, I think you've got to remember that it's the numbers have been coming down for a long time, and obviously this particular issue has really generated itself in the last relatively low number of weeks. So it's been a case of, as things have progressed, so steps have been taken, they've been proactive, and they've put the numbers in.
Okay.
Okay.
Thank you.
Right. Okay. Let's. Should we go online? Should we go to Mike? JP.
Hi. Just with regard to the changes that have been announced today, it now seems to be slightly at odds with the travel policy. The fact that we have isolation or non-isolation, I should say, for direct contact, but people arriving in the island still have to isolate. What was the thinking behind that, and was any consideration given to changing the travel policy?
Do you want to pick that one up, Alan? Yep.
Sorry, can I just start and then perhaps hand over?
Yep.
Hand over. Hi, Mike. I think if I understand the question correctly, we have currently fully vaccinated persons. Not required.
To isolate.
Yeah, it's not required. Isolation is not required. We have a bit of a disconnect at the moment with the younger age groups because they're mainly not vaccinated, so they are required to isolate. I don't know if that's answered your question. If it hasn't, I'll hand over to Ivan. We can't.
You're muted, Mike.
Yeah.
Yeah, sorry, I
Yeah.
wasn't really answering the question because, as I was saying, I think that the changes that have announced today now seem at odds with the travel policy. And yes, I am particularly referring to the sort of 35 and under age group. It seems odd that we can have direct contact, not have to isolate, but people arriving into the island do.
Okay, I'll pick that up. Thanks, Mike. So the announcement today really is based around the community, the on-island community. So track and traced no longer have to isolate. As I said in my, the stack and the team are looking at a number of aspects of that, including the possibility of looking at some relaxation for those who have received one jab. And I'm particularly interested to see what Guernsey are doing at the moment. Currently, in Guernsey, fully vaccinated persons are not required to test or to isolate. So we're all of those points are under consideration. And I think in light of today's announcement and the fact that a lot of work has gone into coming to this decision over the last few days, I think that's a clear signal that we are gaining momentum as we get towards the end of the pandemic.
Richard, you want to add something?
I think it's justifiable to have a different policy for the borders and one that is distinct from our community because we're constantly monitoring what is happening in other jurisdictions, particularly the UK jurisdictions, and if we see risk there, we will respond to it proportionately. So we don't have to align everything with what we might do within our own community. We may do, but that's under review at very regular intervals. But we will try constantly to keep islanders as safe as we can through our safer travel policy. Thank you.
Another question, Mike? You're muted.
Apologies. A few months ago, we seem to be getting a lot more information as to the age ranges of the cases. Would it not be sensible to tell islanders the age spread of infections? If anything, it might back up what you're saying about the risk of harm.
Ivan, are you able to share? I can do some from memory, but you've probably got it closer. Yeah.
So you're right. age distribution of infections is in the in younger people, and this is what we would expect, of course, from the way the vaccination program has rolled out, as well as the admixture of people in the younger age groups. So, for example, something like 155 of the active cases we have at the moment are in the 10 to 19-year-old age group, and something like 96 people are in the 20 to 29-year-old age group. There are smaller numbers in the other age groups, and in particular, only 1 or 2 cases in the under 9-year-olds. So the age distribution focuses primarily in the 10 to 29-year-olds. And this fits in with, as I say, vaccination and admixture. And of course, younger people have much less severe disease, which is extremely salient in the way we are thinking about COVID and how to handle the restrictions thereof.
Okay. Right, Gary.
Good evening, all. We've seen some examples of brilliant leadership this weekend, I think, in inspiring a team to go on to great success. As you look at Gareth Southgate and England's win in Rome, do you wonder about your own leadership and that so many islanders just want to give you a red card? I noticed the apology and the acknowledgements at the top, about 30 seconds of your opener, but I've had people messaging me yesterday and today, a dad on the phone crying this afternoon that his daughter's day 0 test from school, it's now day 9. This is day 9 in prison, waiting for the so-called day 0 test. I know you've changed the rules now. I know we draw a line and life moves on. I just wonder, have you said enough to acknowledge the hell, the anxiety, the stress, the real upset that you caused people, particularly on Jersey Children's Day yesterday?
I think we've got to absolutely acknowledge, as we've said, that this week could have been better. But we've also got to, and in saying that, be really clear, that's not in any shape or form a criticism of the contact tracing team or the whole fantastic people we've got there. Let's be really clear there. Could we have done something earlier? I think potentially, I think we would all say we'd have liked to have done. I think it's evolved very, very swiftly. That's one thing I think we've continually see, actually, is just when you think things have settled down and we're going down a particular path, other matters have come through very, very quickly, and this has changed probably in a matter, I know you're talking about a time of 9 days, but probably over the last week, that's how quickly it's changed. In one way, it's going to sound odd, we're almost a victim of our own success because we've gone through having a really good contact tracing team, which unfortunately then has identified so many direct contacts, plus on top of that the vaccination program. And I think as was actually said at the States Members briefing half an hour or so ago, this was probably the path that we were going to end up in. I think it's come a lot quicker than we were expecting. So from that perspective, we do move on. We acknowledge that, as I said, it has caused severe frustration. It has always been as well about balancing the harms. And I think actually what we've seen this week, of things have tipped to actually that wider overall balance of harm around actually the impacts, particularly on children, and the isolation regime. And don't forget, we did take steps at the beginning of this week to mitigate that isolation regime, which was in recognition of the damages it was doing. So to an extent, we have been reacting to it or responding to it. We have been moving forward. This particular element has come quicker than we expected. I think we acknowledge that, but equally we've done it swiftly. We have responded to islanders' concerns. We have always responded quickly when it is needed, and we have also done it on the back of the professional advice that we've received.
And talking of that professional advice, Dr. Ivan Muscat, I note both ministers keen to say you agree with everything they're doing completely, leaving no wiggle room, and you, in a couple of answers already, have said, I agree with what they're saying wholeheartedly with no wiggle room. I just wonder, given that you're all on the same page finally here, and I'm sure in 3 light years the stacked minutes will confirm that, can we just turn all of this on its head? There are people tonight now messaging me fearing tomorrow in Jersey, because regardless of all the comforting words and the facts of the brilliance of the vaccine, which is doing exactly what you expect it to do, there are some people, frankly, scared to go out tomorrow. I just wonder what words of advice, of context, of perspective, Dr. Muscat, you could give those people tonight.
Sure. So the vaccine really has changed the face of COVID. There's no doubt about it. And we continue to encourage those who are eligible for vaccination who have not yet been vaccinated to go and get vaccinated, either the first or the second dose, whichever is due. We really need to complete that program. It is vital. It is also vital, if boosters come about this coming September, October, that we actually pursue that path as well. Whilst I'm on that thread, if you like, it is also very important as we go into the coming winter that people take up the flu vaccine as well, because that is also a respiratory virus, and we want to minimize the damage caused by respiratory viruses as a whole. To come directly to your point about some people feeling afraid of going out, then they do have within their power the ability to determine what type of activity they undertake when they go out and about. They can opt to pursue more low-risk activities rather than high-risk activities. It is a personal choice, and we are moving very much from blanket restrictions to giving people personal choice, because we are in a different territory at the moment. So low-risk activities, as we all know, include outdoor activities, appropriate physical distancing, having consistent groups that you meet with rather than disparate groups all the time, maintaining appropriate hygiene when indoor, ensuring appropriate ventilation. So people do have in their possession the ability to minimize risk, but still enjoy the freedom, the degree of freedom they wish to enjoy. It is also important to counterbalance that with the importance of not incarcerating people unnecessarily. Of course, they too have a voice. And they too need to be listened to. So the whole dynamic is trying to manage the balance of all the harms for all the people all the time. But that balance changes from day to day as vaccination rolls out, as we learn more about the significance of vaccination, and we need to keep pace with it to be as fair as possible to all concerned. It's never going to be perfect, because it's going to be a balance, and sometimes the balance wobbles a bit from day to day. But in the main, I think we're managing to stick to the middle of the road.
Fiona.
Thank you very much. In the last conference, Dr. Muscat was very clear. He said there were 4 pillars for dealing with an infectious disease: diagnosis, infection control, vaccination, and treatment. He said until that last one's in place, we shouldn't let our guard down, to use the government's own terminology, particularly given the threat of potentially vaccine-resistant variants. It seems today you've made an official break from that by not having isolation until at least day 0 testing, and we've moved into live with it territory. At this moment in time, what's the rationale for retaining those very final restrictions? Why are we not, to use Senator Farnham and Senator Gorsuch's expressions, not having Freedom Day now alongside this?
Ivan, do you want to pick up on that, and then I'll...
You're right, the 4 pillars are yet incomplete. However, the position we're in at the moment does justify this move towards testing people who are direct contacts but not isolating them. The price to be paid for isolation is quite high. the benefit, on the other hand, of the last remaining restrictions, which are due to be lifted, I believe, in mid-July, if all continues to go well, the benefits are not as great as allowing people to leave isolation if they're direct contacts, which is why the priority is the way it is at the moment. It is true that we do have a concern about the possibility of vaccine-resistant variants, which is why, amongst other things, we test at the border, and sequence viruses, of course, and why we keep an eye on variants in other countries, in particular the UK, which we have huge connectivity with, and we will, in our decision-making, always bear in mind what's happening with those variants.
I think what I was going to say on top was obviously the so-called Freedom Day, as it were, is I think 11 days away, so we're not far. We're aiming for the 15th, and I think ministers have already given their views on that subject already. Obviously, the logic of that day is that it's still trying to do the very best to keep basically allowing the schools to continue in as uninterrupted fashion as they possibly can, and obviously then by opening up on that last day of term, on that last day of the summer term, that does at least give some support to still achieving that objective. Do you have another question?
Absolutely. If I could just turn to you, Chief Minister, in your opening speech, you said the policy had been revised due to the excellent vaccination programme and the risk of serious illness being diminished. But I just want to sort of inject maybe a bit of transparency into all of this. I don't know if that's wholly accurate, is it? Because the contact tracing system, as we know, absolutely fell over this weekend. The change came possibly much earlier than it would have done otherwise. Many islanders imagined that this would have come alongside Freedom Day. Many islanders said they felt it would have been sensible to isolate until the first test. And we've now also lost perhaps what was a key incentive to get vaccinated, being able to be released from isolation sooner. STAC obviously knew, and you as ministers knew, that cases were going to rise, direct contacts were going to rise massively. Why wasn't this planned for? Why weren't the resources in place? Because perhaps we wouldn't have had this premature capitulation otherwise.
No, I think that is a very good question. I think, as I said, I don't think I can add much more to what I said to Gary in my response to Gary, and I think whether Richard or Ivan want to come in on this afterwards, but this has come quicker than we had anticipated. I think the expression that I think it was Ivan used, that this is a dynamic situation that we've been in. It continues to be, but that shouldn't move away from the fact that we do have a fantastic vaccination program, and we have had a really good contact tracing system, and it continues to be a good system. It has had a difficulty with the volume of people, but the fundamentals are those two things still remain in a good position. What we've done, obviously, in responding to the position we're in, we have taken steps to address it. The fundamentals that obviously are coming through because it is impacting at younger age ranges, and particularly the impact on children. We've listened to the advice and responded to that advice to address it. Richard, do you want to add anything at this stage?
Just reiterate, Chief Minister, that it really has been a very fast-moving situation, changes week by week, so it's different this weekend than it was last weekend, very different feel to it. And it has tipped the balance. We have seen that the disadvantages of requiring people, and who are particularly children, age 10 upwards, to self-isolate for periods until we can reach them, to give them their first test. That requirement is outweighed now by the harms that would be caused by that isolation if we persisted with it. So it is right and proportionate, and that's the advice we've received, to make the changes we're announcing today.
Okay. Right. I think final two questions for Harry, and then we'll see how we're doing on time.
Good evening. I'll start with schools, if I may. Dr. Muscat, you mentioned that a lot of the cases are amongst younger age groups, and I've heard of a lot of parents before. They were worried about direct contacts and talking about pulling their children out of school, with cases possibly going up, and with them being amongst school children, they may still be thinking about pulling children out of school for the final 2 weeks of term to avoid the chance of that happening so they can enjoy their summer and their summer holidays. What would you say to parents about that? And also along that front, are we considering introducing lateral flow tests for younger secondary school age children? We've been doing it for year 11 to 13s who are coming towards the end of their time at school now. Why can't we do that for younger children so they get negative tests and they can move on?
I'll push lateral flow down to either Richard or Ivan potentially. And in fact, Ivan, do you want to go for that first? Then I'll pick up on the last bit.
I've heard we are increasingly.
So we are increasingly thinking of detecting infection and managing infection rather than detecting direct contact. So we're changing our focus as a result of the changed significance of infection due to COVID. And in step with that is precisely the possibility of extending lateral flow testing to younger secondary school children. I can't tell you exactly where we are with that. It may not happen this scholastic year. It may happen this forthcoming scholastic year, but it is certainly part of the plans that we are looking at.
What's the deliberation? Why can't we just... What's stopping you from doing it right now?
I think we need to make sure that we've got sufficient sort of resource to actually deliver it at school level. We want to, and we are engaged with SIPES to ensure that we can do it. The younger the school children, the more supervision and care you need, as you know. And it may be very reasonable to actually go ahead and do it before the end of the scholastic year, because that is one way of focusing, as I was saying, on infection rather than direct contact. So putting our efforts in one basket rather than another.
I think it goes back to your earlier point. Ultimately, yes, it is a parental decision, but ultimately the point is the best educational outcomes are for children to attend school wherever possible. And that's, we've hopefully demonstrated all the way through, but we've also reiterating at the beginning of the week. But obviously there are discussions continuing with heads literally today and tomorrow morning, and also making sure that the right support is there in terms of online teaching, etc., for the remainder of the term. But I think at this stage, the view to date has always been the best place for a child is in school. Okay. Second question.
Yes, please. So obviously you mentioned cases will probably rise as a result of this, and hospitalisations may as well, although with the caveat that you hope they remain low. But with anyone that has someone in hospital, that could be an awful experience. We don't want to have a low number, we want to have zero in hospital. To combat that, was there any consideration to reintroducing measures like making people distance, for example, to lessen the risk of more people going into hospital, for example?
Well, I think you've always got to remember that whatever one does now will take 2 weeks plus to take effect, and the guidance has always for example, the measures you've referred to still remain in the guidance in terms of if people do feel concerned or whatever it is, and they should continue to distance. We're certainly reiterating the point about keeping the hand sanitizer, keep washing your hands and all those type of those kind of things going. But in terms of, as we do say, the impact, what we've tried to do is not to go backwards. So we delayed the final stage of stage 7, the reconnection, because of the way the concerns we had at the time of the way numbers were going. But we've not gone back and said, actually, we're going to do measures X, Y, Z, because the whole point about this is, I think, as we've said, you've got to look at the overall impact across society. You've also got to keep an eye on where we are for summer, and as Ivan has referred to, one of the other wider considerations we're looking at is things like winter, things like booster vaccines, things like flu vaccinations. And I think there's a point when, as a society, the overall view is that people are ready for these next steps, and actually the overall balance of harms is such that the measures we're putting in are proportionate. And actually to put other measures back in causes other consequences, which actually tips that balance and the balance of harms the wrong way. I think that would be it's a long way of saying it, but that's probably the response.
Yeah. Sorry, I'll let anyone else come in before I...
Well, can I just say that the hospital will always be ready to treat any COVID cases that might present, but we'll also be ready to treat and supply all the other services that we would always find in our hospital. And then we must bear in mind that the vast majority of the cases we are seeing now are amongst younger people, children even. And we know that the cases will be less severe in those age groups. So we are not expecting a large influx of hospital patients. We'll always be ready for any that might need it, but we're not expecting that. So we're confident that we can continue to offer all hospital services. We're confident that this is the right step to take as we're announcing today.
And still as confident that 15th of July will be Jersey's Freedom Day, despite the added risk and possible increase in cases that these measures might present.
We're always going to keep an eye, day to day, on what is happening in the island, but our plan is to proceed on the 15th of July.
Okay, thank you.
Thanks very much. So I want to, just before I start to sum up, we hope we have responded to concerns of islanders that have come across a number of us as members and our emails, etc., over the last few days. And I think we do, as we've said, need to emphasise that there's never going to be zero risk in all of this. We've always taken account of the balance of risks and the overall impacts of harm, whether it's the harm from COVID directly, whether it's the wider harms health-wise, or whether it's harms to well-being and in the economy. And this is yet another step in, as has been said, a very dynamic situation. But I do want to thank all the media for attending tonight and everyone watching at home. Whilst this press conference was announced at short notice, all ministers agreed it was important to get this information to islanders who are still isolating as soon as possible. We remain in a good position with low hospitalisations and a high vaccination rate. We are all learning to live with COVID in our lives, and I want to thank you for your continued patience, cooperation and commitment as we see our island through the final stages of this pandemic and to a summer for us all. Thank you all very much, and good night.